Strep throat is actually an infection of the throat with Strep pyogenes, which is the bacteria that's often harbored in the tonsil. It's hard to determine exactly which pharyngitis or sore throats are strep, so you certainly can't do it at home. You'd have to go to the doctor and they'd have to do a culture or what's called a rapid strep test. Sometimes you'll have a headache with it or abdominal discomfort and you won't really even have the sore throat as much, and so that often happens with children with recurrent strep. Oftentimes if you have other symptoms like nasal congestion, muscle body aches, that's more likely to be flu-like symptoms versus just a strep throat, because that's oftentimes isolated to the throat with maybe the headache or the nausea versus the nasal congestion, drainage, cough, and muscle body aches. Well, you have to treat with antibiotics because it's a bacterial infection, and if you keep getting infections over and over again, you may need to see a specialist about removing the tonsils. We believe that the tonsils themselves harbor the bacteria, and there's good studies that show even if you give 6 weeks of antibiotics, you cannot eradicate that bacteria in the center of the tonsil, so removing them removes the nidus of infection to decrease the chance you get the strep infections again. Well, when you do a tonsillectomy, there are some concerns that you have to consider. I mean, they are part of your immune system. However, once a child is old enough, usually older than 3 or 4, then their immune system is pretty mature. And out of the 50 million kids that have had their tonsils and adenoids removed over the last 30 years, nobody's been significantly immunosuppressed. Normally you get better because the infections are gone. And there's 300 lymph nodes in the back of the nose and neck that do the exact same job. They're part of your immune system too. So when you remove the tonsils and adenoids, even though they're in the forefront of the fight, the other lymph nodes will take up their cause and process the bacteria and make antibodies. And there's about 8 or 10 studies that show when the tonsils and adenoids are infected, then they don't work anymore anyway. So you just have this cesspool of bacteria sitting in the back of the nose and mouth that's not doing anything for you.